Welcome back to the House of Wellness. We're reaching you in Brisbane, Sydney, Melbourne, Adelaide and Perth, and we'd love you to give us a call, 131 873, specifically at the moment if you are suffering from a chronic wound. Every year, over 420,000 Australians suffer from a chronic wound. It is a silent epidemic in Australia. I can imagine a very difficult thing to live with. It's significantly under-recognised public health issue. It can damage mental health, stop people from working, studying, enjoying the lifestyle others take for granted, and of course is a financial burden as well. To tell us more, we're joined by Dr Nikki Frescos, Wounds Australia Chair. Good morning, Nikki.
Good morning. Thank you for inviting me to your program.
Well, when we talk about chronic wounds, what are we actually talking about?
So what we're talking about is an injury to the skin, basically a break to the skin that's been caused either by a cut or a tear or a bite, and it's been there for more than 4 weeks. Usually an acute wound will last for 1 to 2 weeks before it heals. However, if the wound has been there for longer than 4 weeks, it's indicating that there's something that's slowing the healing down, so it's not progressing through its normal healing stages. So that's when you need to really seek out what is actually happening. Why isn't my wound healing?
As well as the physical impact of a wound, obviously there's this huge emotional impact. I mean, depression, anxiety, negative body image, and obviously that leads to isolation. I mean, does the mental side of it really exacerbate? Because obviously, you know, the more stressed we are, the harder it is for our body to heal itself.
Totally. You have hit the, exactly. So anxiety, the anxiety is more to do, and stress is more to do with, is my wound going to heal? What's going to happen? And particularly with the age population, they're quite concerned, like, if my wound isn't healing, what does that mean? Am I going to be admitted to hospital? Am I going to lose my leg? There's even cases of suicidal ideation. So it is quite scary for many people. And the thing is, they don't tell their doctors about how concerned, scared they are about it, and that's concerning.
Nikki, let me ask you a hard-hitting question. We have, and you see and I see constantly and hear from people who regularly go once or twice a week and they have their wound dressed, and this is all very lovely. However, at what stage, you mentioned a month, now at what stage should a person say, do you know, I'm not happy with the rate of healing here, what else can I do? Where do I go to have this thing resolved?
Okay, so if you've been seeing, if they have been seeing a doctor for a little while, say past more than 6 to 8 weeks, and there isn't any progression towards healing, the questions that should be asked is, why have I got this wound? What is happening that is slowing this wound? So I have this saying, it's not the whole, it's the whole person that should be looked at.
Yep.
So there's some underlying issues that are happening, and it's not just you see a sore. It could be that there's a chronic disease that hasn't been diagnosed, or that the existing chronic disease hasn't been considered in the healing process. So there might be an issue with arterial problems, or their veins might not be working. So you need to address that. You need to assess that and address that, and then you'll do the most appropriate management that will heal the wound. It's amazing. Once you work out why the wound isn't healing, and then you know exactly what to do.
It's interesting, when I was reading through your information, you said the average age is 65. I mean, it looks to me, whenever I've seen this, people are elderly, they're not really into the whole holistic. I mean, they're less likely to go into a holistic way. But what else? I mean, how dangerous is this for the elderly people?
Oh, it can be, if the wound doesn't heal within appropriate time, and you've got an open, a sore that's open to any sort of elements, bugs, etc. The longer the wound is there, the more bugs it gets. So you can be exposed to or create infection, and an infection isn't addressed appropriately. It can lead to cellulitis, which then can lead to systemic problems, and particularly with a diabetic foot, it can lead to amputation. The other thing is that people don't realise, and I don't want to scare people, but sometimes when you've got a wound that's been there for a very long time, it can turn into a skin cancer. And that can be misdiagnosed. They think it's a wound that's not healing, it's oozing, let's do this, let's do that, we'll try this particular dressing. But you need, when the wound's been there for way too long, you need to get a proper diagnosis. And the best approach to that is taking a biopsy of the wound to test, to see exactly what's happening in that skin, and that will, pathology will give us the results to determine exactly what's going on.
Nikki, it is so great to speak with you, and I think the really important message going into Wounds Awareness Week is just to be really compassionate towards people who are living with this, particularly in and around the $4,000 annually that this costs them, and really understanding that it's a difficult life. It's a lot to manage for someone. It
is. And people with leg wounds, they have bandages, the wounds ooze, they're embarrassed to go outside, they might be smelly, there's pain, and a lot of people don't tell their family, their friends, etc., that they have these wounds. So they stay at home. They're too embarrassed to go out. And their dressing changes because they can't fit into shoes, or they don't want to show that they've got back. It's a plethora of problems that's associated with the wound.
I can imagine. So you're doing amazing work there at Wound Australia. Your website is a great resource too, woundsaustralia.com.au. Thank you so much, Nikki. Have a great Sunday.
Thank you.